Welcome. In this lesson, we are going to look at the tremors and diastemas treatment, and this example will show us the advantages of aligner treatment. The virtual setup is of a patient whose main concern was the spacings between the frontal teeth. We can examine the setup from different angles, and we can clearly see the diastema between the centrals and the tremors, or both on the upper and on the lower arch. This pathology is considered rather mild for alignment treatment, and here we can see the virtual setup and the initial and the finish position as it was performed in the Exceed lab before and after the treatment. If we examine the upper arch, we can see that there is diastema between the centrals, but also some other spacings or tremors in between the canine and the premolar. Now, if we follow the movement, we can see that the teeth are moved in different planes, like mesially and also palatally, to close the spacings. It's clearly seen from the occlusal view. You can follow the movements of the teeth and see how they are moved according to the setup. In the end of the treatment, all the spacings are closed. Now, if we look from the frontal view, we can see that the centrals are also moved with changing their angulation, and they are a little bit derotated. This helps to close the diastema with nice aesthetic results. As you can see in the beginning, and this is the movement that we can achieve with the aligners. We can evaluate the movement from the occlusal view again. Keep in mind that we have the movements in different planes, which helps us to create a good result and a very nice aesthetic look. Now let's analyze the lower arch. If you remember, we also had tremors and diastemas here, as you can see, between the premolars and canines, between the centrals again, and also on the left side. Basically, the movements of the teeth here follows the same on the upper arch. That is the mesial movement, the lingual movement, and also a little bit of intrusion to correct the occlusal plane. In the end of the treatment, all the spacings are closed. If we look from the occlusal view, we can see how the teeth are moving, both mesially and lingually, closing the spacings. Now, if we look at the model, we can see the attachments. We remember that the triangular ones are used to fix the aligners and are used as an anchorage. At the same time, we have the vertical attachments that are used to control the teeth movement, both their angulation and derotation. This green attachment is actually not performed on a tooth. It is so-called power reach on the aligner. It is used to better control the bodily movement of the tooth, as you can see it from the side. Now, if we look at the time of the treatment, it says 17 aligners on the upper and 20 aligners on the lower. That means about 10th month of treatment. The case is quite easily treated with aligners, with some good results and in a quite quick time. One thing to remember is that we strongly recommend using a fixed retainer after treating diastemas and tremors, as it ensures a constant teeth position control. Because when you use a clear plastic retainer only at night, for example, the teeth might move a little during the day, thus creating an unwanted movement. The teeth will be in small but constant movement without maintaining a stable position. The same thing is recommended for the lowers as well. The ending result is nice, with good aesthetics and in an appropriate time.